Hi, everyone. We all set here? Can everyone hear me? Can you nod if you can hear me? It sounds like people can hear me. Cool. I have a very brief update, and then I'm going to hand it over to Chief and Director Bond if she has anything to add. So we have 13 verified cases of COVID-19, probably many more in the city, but 13 verified. One person this morning tested positive for COVID-19 and has been hospitalized and is stable. The individual was in a small substance abuse recovery shelter in New Haven. Another individual at the same shelter is suspected of having COVID-19, and all of the other individuals at the shelter are being tested right now and self-isolating. We still continue to look for N95 masks. We had a really great donation by the Regional Water Authority today, who donated around 200 masks to us. Deeply appreciative of that. We also found a good number in some of our public schools because they have, wood shops and things like that. And so we're leaving no stone unturned to try to find masks to keep our public safety workers safe. And the only other update I have is more of a thank you. We've noticed that so many people are following our directions around town and are diligently doing their part to make sure that they're practicing social distancing and making sure that the community members are safe. Of course, there's occasional groups of people that are not doing that, but by and large, people in this time of crisis are trying to do the right thing, and I'm very appreciative of that. Wanted to make note that the WHO is recommending people not to use untested drugs. There's been some parties out there that have been encouraging people to use different drugs to respond to COVID-19, and that's not appropriate, and WHO is recommending that people do not do that. We don't want to put people more at risk. And I also wanted to continue to remind people, if they do have symptoms, to call our health department emergency line. If they have a cough and a fever, to call 203-946-4949, 203-946-4949. Why don't I hand it over to Chief Reyes to see if you have anything else to add.
Thank you, Mayor. Just to add to the donations, actually, we got Walmart, our local Walmart, and another local construction company actually delivered equipment, various equipment to the front desk. So we're vetting that stuff out, but just want to give a shout out to them and say thank you to Litchfield Builders and Walmart, who are contributing to public safety. We're definitely appreciative of that.
Chief, I got mine from my basement here that you can, I got to get to you at some point.
Thank you. So unfortunately, at around 1:20 this afternoon, we had a shooting over in the area of 75 Whaley Avenue. Individual was at the window of Wendy's, at the takeout window, when another individual walked by and began to shoot at the vehicle. Unfortunately, the driver was struck in the arm. It appears that the exit wound might have also gone into his body, and so we're still waiting to make sure that he's out of the woods. It looks like he's going to survive his injuries. What ends up happening is he gets shot. He drives away, attempting to just obviously elude the gunfire. He ends up crashing in the area of 88 Broadway, and the vehicle rolls over. Again, it appears that he's going to survive those injuries, but we are waiting to see how he comes out of the OR. We have identified that individual, and he is someone known to us, and we'll put that information out as soon as we can confirm it.
Thanks, Chief. Anything else?
The only other thing I wanted to add was that yesterday The independent followed us around with our officer doing the public service announcements, and those are going very well. They're being well received by the community. And so we will be continuing those throughout the week.
Director Bond, do you have anything you want to add?
I'm going to defer to the questions. Thank you so much.
Okay, so let's open it up to questions. Shana.
Hi, Mayor Elicker. Just
Hey.
wanted to follow up. Do you have any update as far as any new facilities, or has there been talks about what's going to happen with the homeless population in the city? We've been receiving a lot of questions and concerns about that. Have you had any further conversations that you're able to kind of talk to us about?
I appreciate you asking. Unfortunately, I don't have any major updates. Our team is working very hard to make sure that we can identify staff for the career site. And we also are exploring other options that we may need for other expanding the places where we're allowing people to self-isolate. This, as you've seen from what's happening in New York, for example, they're identifying some offsite locations because the hospital's overwhelmed. And in particular, New Haven, we have a relatively large homeless population, and we want to make sure that we have facilities for people to self-isolate. And so we're working hard to come up with a plan there. But I don't have a very concrete, anything concrete to share with you at this point.
Do you have any update as far as the regional career high school and how that plan is working? Have you started to bring any people there? I mean, can you give us a status update on that? I know there was some controversy last week regarding.
Yeah, as of now, there's no one there, or we have not brought any people there. We're still completing our implementation plan.
Gotcha. But are there any other sites for people that are homeless and test positive that you're considering outside of career, or is that the only site at this moment that's being used?
For people that test positive, career will be the site. We are looking for other sites because there are individuals that may be experiencing homelessness but have not been tested yet. And when they're exposed, we need to separate people from each other, because if there's a group of people and one of them has symptoms, we don't want the rest of the group to be together, because a handful of them may end up getting COVID-19, but not all of them. And we don't want them all in a group, because then they will infect each other. So we're looking for other sites where we can help individuals self-isolate.
Have you been in touch at all with Yale University or any, neighboring school that has some bigger facilities that may be able to, help in this process?
We've been in active conversations with a lot of the local institutions. I don't have a concrete plan to share, but we've been in active conversations.
Thank you, Mayor.
Thank you. Other questions? Tom Breed.
Hello, Mayor. So you mentioned that one of the most recent New Haveners to test positive for COVID-19 is an individual at a small substance abuse and recovery shelter, and that another individual at that same shelter is suspected of having COVID-19. I believe you mentioned over the weekend that someone who tested positive was an employee at a recovery program. Is this the same shelter or program where an employee tested positive over the weekend?
Do you want me to take that one, Mayor?
Yes.
Oh, hi. So thank you for your question. So we have 3 people that were within the same system, and they all tested positive, and one was an employee, 2 were clients, but they were being serviced for 2 different programs within the same system.
So same system, but these 3 people, 2 have tested positive, 1 suspected of testing positive or suspected of having the respiratory disease. They're not necessarily in the same building. Is that what you're saying?
They're within the same system, and the 3 of them all tested positive, and all 3 of them are currently hospitalized but stable.
But were they all interacting with one another is the question? Or are
The
these
3 were
three?
not linked. They were not linked directly with each other, but within the same system.
So 2 of them were, correct, Director Bond? So
Mhm.
Tom, so there was 1 person this morning that lived in the same shelter as another person. The first person tested positive for COVID-19 and the second person is suspected. Separately, there's a 3rd person that tested positive that works within the system that supports this and other facilities. Does that make sense?
Yes, yeah, that's very clear. Thank you. And then you said that everyone else in the shelter is currently self-isolating or taking some precautionary measure. How many people are currently taking those precautionary measures because they are at the shelter?
Director Bond, you
So
want to
we
take
have,
this?
yeah, so we have approximately 15 individuals, of which 2 were symptomatic, and then the others are being self-isolated and taking the proper precaution, and they will be tested as well to ensure that they are not going to be positive for COVID-19. But they're all in self-isolation currently.
And which shelter is this? And if you're not going to share the name, why not?
We have to try to not compromise the confidentiality of anything reportable, and so we want to safeguard those individuals. We also do not want to stigmatize any one group over another. So we want to try to preserve the privacy of those individuals that are potentially infected and those that are affected by this.
So Tom, this came up last time, and I think that we can have a conversation internally about whether we can share the site. But our impression last time was that we should not be sharing this information. The state shared the information, and we felt that was done inappropriately. But we will have a conversation internally on whether we can share any more information on the site before your team gets too excited.
Well, I guess for the record, I would strongly advocate for sharing the name of the site, for having the public have as clear an understanding as possible as, which social service might be right now a hotspot for people communicating this disease. If that's not the case, then feel free to say that.
Yeah,
but it sounds like
I think that's part of our concern, right?
Mm-hmm.
Part of our concern is that if someone, say, has COVID-19 at the hospital is still a place where they are conducting very safe procedures, and we don't want the public to panic when we name one facility because there's an individual at that facility that may have COVID-19. And so part of our concern is making sure that we're protecting the integrity of organizations from misinformation or misunderstanding of the actual the significance of small pieces of information.
I have a few questions for Chief Reyes, but I know I've asked a few already. I'm happy to defer for a minute and then come back.
Okay, I appreciate that. Do other folks on the call have questions?
Yes, I have a question.
Go for it, Mary.
I'm sorry, I'm having problems with the computer, so I'll just catch up with you later on what you just detailed about the shelter. So I have questions for Chief Reyes too. I was just trying to get a real sense of what happened yesterday and how the individual, the homeless individual, was tracked down in Milford. Was it someone in Milford, the police there found him? Any kind of details? And how did he get there? I mean, did he get there by bus? Did someone take him
there? So we received information that the individual might be at the intersection of Church Street and MLK Boulevard. Officers went there. Coincidentally, the individual they stopped had a stark resemblance to the individual we were looking for. when he was transported, arrangements were made to transport him. He agreed to go to the hospital. When arrangements were made to take him to the hospital, it was determined that it was the wrong individual. We continued our search for the individual that we were looking for, followed some leads, and we were able to determine that he was in fact in Milford, staying at an undisclosed location there. And so I made the appropriate notifications to Director Bond and to the authorities over in Milford so that they could take the necessary precautions.
I guess the other question I'm sorry, I have another question for Maritza Bond, please.
Yes, good afternoon. How are you?
Good, how are you? Did you have to issue a separate order to have the man continue to be quarantined once he was picked up, or he's under the initial order to be quarantined?
So once the order was specific to the hospital, once the patient left my jurisdiction, I reported that to my colleague in the other city so that they can take on the monitoring and surveillance from there.
Oh, so he's being monitored by the public health director in Milford?
Correct.
This person, how long was he supposed to be under guarantee or in isolation, essentially, in New Haven, in the hospital? How long was that issued for?
The public health order of quarantine was issued at the discretion of the physician to medically clear the individual. We were informed that he was in the process of being medically cleared, but decided to just leave the hospital. And so they weren't able to formalize that process for the sign-off. And so that information was then shared with the proper jurisdiction so that they can continue the monitoring of the individual.
All right. So at this point now, he doesn't have to be quarantined? I mean, was he officially released by the hospital?
He was not released by the hospital. He was going to be released by the hospital. He left against medical advice. And so he is now under the jurisdiction of another city. So they are now tracking him. So I don't have any further information on that.
So Milford would know what he is. But I guess the question is he still able to infect other people?
He's being monitored by the Milford Health Department to ensure that he's not symptomatic and being monitored through them. And so I would definitely defer to Milford to inform you of what steps they have taken since we reported that to that jurisdiction.
All right, I'm sorry. I may have to talk to people afterwards because my internet is not behaving.
Yeah. So I just want to clarify that it's important that I also adhere to HIPAA in disclosing any information about individuals that may be infected. And so we want to try to ensure that when we're responding to questions, we are providing the most information that we can, while also respecting the individuals under HIPAA. So I just want to clarify that for any reporters asking specific questions relating demographic information and location.
All right. I'm sorry if you said this already, but anything else on the opening of the career shelter? And I mean, it looked, possibly that this individual might have been qualified for that. I guess he isn't now, but any more information on staffing?
So there's no updates there. I would say that this individual is an example of why the isolation center is important for us. We want a place where we can ensure people are isolated and cannot leave. And those individuals that are healthy enough to not be in the hospital, but need to be quarantined or isolated, don't have a place to go. And the hospital needs to focus on making sure that people that need to be there are there. And so this circumstance underscores why it's very important for us to have this site online. We're working very hard to get the site online. But as you can imagine, it's very complicated to do that.
Right. The statement from the hospital itself basically said they're working with the city to help find, I guess, places for individuals who aren't no longer hospitalized to stay if they're homeless. Is that, what does that mean? I mean, is the hospital, they're not going to keep people, are they, beyond the point where they are medically stable? I mean, they're essentially not a site for people to stay there if there's no place else for the individual to go.
We are looking at all possible scenarios to assist in supporting individuals that are medically cleared but need somewhere to reside during the duration that they still need monitoring. So we're looking at all different scenarios, and we are in communication with our local community health centers and our hospital to ensure that we're working together to address their needs. And so as we get more information, we will be sharing that information with everyone. But right now, we're still trying to finalize some of the logistics, and then we will be reporting out once we're ready to activate.
All right. There's just a number of things.
To add to that, Mary, I'm not sure if this will answer your question, but a lot of this is about triaging what will be many, many, many people. And you want every entity that is providing some sort of support to be working together and addressing whatever the issues are to the top of their ability and not having to manage issues that aren't as urgent. And so what we're trying to do is work with the hospital to identify other alternatives where we can alleviate some of the pressure that they will have for rooms so that they can focus on the people that most need their attention, those folks that need to be in ICU or in step-down units. And so part of this partnership is us making sure that we provide the hospital for other alternatives. And in particular, the homeless population is a group that has oftentimes a lot of needs. And we feel like once we get this system rolling, we can help support the hospital so that it can focus on those individuals that are in real medical, in a medically urgent situation.
Right. I mean, that makes sense. It was just a little confusing that the hospital was almost saying, they were keeping this particular individual because there wasn't a place for him to immediately go. Maybe that's not the case.
I can't speak for the hospital. I
Yeah,
think all of us do not want individuals with COVID-19 wandering around the city.
I have other questions, but if people want to ask something else, it's fine. I'll ask
Okay.
it.
Anybody else have a question? Should we go back to, let's go to Shayna and then Mr. Breen.
Just want to clarify, Mayor, I know we talked last week in detail about the facility over at Career High School. So I think we just want to confirm if someone who is homeless contracts COVID and is not serious enough to stay at the hospital and qualifies to stay at the high school, what measures are in place to make sure that they stay and they don't leave on their free will? Is that something that you guys are also having a plan for? How do you plan on keeping people there?
Correct. So our police department has visited the site and done an assessment about how they can make that happen.
Okay, but it is true that once you're in, you can't leave.
Unless a medical professional releases you.
Gotcha. All right. Thank you, Mayor.
Or your condition becomes more urgent that you need to be transferred to the hospital.
Gotcha. But it's not a place where you can just walk out and say, I don't feel like being here anymore.
No.
Understood.
Mr. Breen.
Mayor, what do you think of Yale's decision to establish a kind of similar shelter for people who have COVID-19 but are not ill enough to require hospitalization at their Payne Whitney gym, but reserving that space for members of the Yale community? I assume that you're familiar with that facility, but what has been your, what do you make of it? What has been your reaction to Yale's decision?
I think it's a positive step that we have more facilities in the city that can alleviate pressure on the hospital. And I think we all need to work together.
Do you think that it should be open to members of not just the Yale community, but New Haven more broadly?
The comment I'm going to make is I think we all should work together.
So I've heard quite a few questions from readers about what specifically you're doing to protect people incarcerated in the lockup at 1 Union Avenue from potentially contracting COVID-19. And in particular, we received a set of questions from the Connecticut Bail Fund, which is a local nonprofit that raises money for low-income individuals who can't make bail. And I just wanted to read very quickly 3 of their demands, which is that your administration release everyone from lockup at New Haven PD, institute a total moratorium on custodial arrests, and make public the exact number of custodial arrests by NHPD during the crisis. But really the question I want to ask is, can you speak a bit to what your administration is doing, maybe Chief Reyes can weigh in as well, to protect people at lockup?
So let me start and then I'll hand it over to Chief Reyes. But we cannot and should not release every person in lockup. Most people don't spend a lot of time in lockup, but some people in lockup are suspected of doing pretty heinous crimes. And I think that us promising we're not going to lock up anyone is not an effective way to keep our community safe. Nevertheless, the chief and Director Bond and I have had multiple conversations about how to keep people safe in lockup during the time that they're there. And the chief has reduced the number of people in lockup, increased the level of and frequency of cleanings in lockup. I know Director Bond was there doing a walking visit of the lockup to make sure that there was the health department's eyes on the facility and give additional recommendations. While I would love to say that we should let everyone out of lockup, I think that's an unrealistic scenario and actually does not improve the safety of the community. Chief, do you want to weigh in?
Sorry.
There you go.
No, Mayor, I think you covered all the points very well. We're both working on minimizing the number of people that come into lockup, right? But we're also doing a better job of working with our maintenance companies to make sure that the facility is cleaned daily and very thoroughly. And the health department's been there. So I think the mayor covered it very well. We're taking all the necessary steps. So if somebody needs to be there, it is as sterile an environment as we can possibly make it. And we're looking to identify anyone who may be exposed or if they have some underlying conditions so that we can segregate those folks, and we have the ability in the facility to do that. So I feel very good about the partnership we've done to make sure that we have the best possible outcomes in lockup for people that must be down there.
And what does that reduction in occupancy capacity look like? Do you have a sense how many people are currently there, and are you allowing to be there during this crisis?
So typically we have anywhere between 15 to 20 people per day at lockup, and then on the weekends, obviously that number can grow a little bit. But we right now have been averaging about 7. So we have definitely seen a significant reduction in lockup, and we are, again, making every effort to minimize how many people have to come in.
Thank you.
You're welcome.
And Director Bond, when did you visit?
So, hi, Mayor. I did an assessment of the facility this morning, and had a virtual, assessment and visual assessment, I should say, of the facility, and was provided the protocols, and was able to determine that their protocol does meet the safety standards that are necessary to safeguard those individuals going through the processing center there. So I was very pleased with the assessment. Great job, Chief.
Thank you, Director. Thanks for doing that.
Should we go back to Mary? Does anyone else have questions before we go back to Mary? Go ahead, Mary.
Thanks. These questions are for Maritza Bond.
I think Michael did, Mayor.
I'm sorry.
Yes, Mary.
Yeah, there's just a number of things in statutes about, the director issuing, putting these people in isolation if it's needed to happen. Mm-hmm. So I just wanted to ask, I'm sure it happened here, but Was that order given to him put in writing? Was he told about his rights that he could actually appeal it and go to the probate court?
That process is was provided to the individual through the hospital, and so that once I issue the order is then discussed with the patient through the health system. The
All right, thank you.
I see Michael had a question. Hang on, we're trying to unmute you here. There you go. Still can't hear you. It looks like you're not muted. It may be on your end.
You may want to hit *6 on your phone.
You could type it in the chat, Michael. If you have chat, there's a box on the bottom of the screen, and then you can type the question. While we're waiting, does anyone else have a question? Tom.
Can you, okay, thank you. The governor's latest emergency order about closing kind of in-person business for non-essential businesses starts at 8 p.m. today. So wondering if you could just speak for a minute about, I don't know, if you were speaking to New Haven business owners who do fall under that non-essential business classification, what do you say to them as they prepare to shut down indefinitely for this latest order?
Yeah, I think this is a really, really challenging time for everyone, and it will be very difficult, in particular for our small businesses, to survive. There are some folks in the business community that are working to be very creative on how they can get through this time, in particular with restaurants and food delivery services and takeout. There's been some innovative ideas that people are working on so that they can both serve public safety workers and community members and keep their businesses going. But nevertheless, this is a very, very difficult time for people. What I can say is that our economic development department is in conversations with the state, and I am hopeful that the federal government also will continue to inject more money into the support that local businesses need to get through this time. It's much more difficult to start a new business than to keep a business going, and we want to support our local businesses. I think the other important thing to note is that while this is going to have a deep toll on our businesses in New Haven and other communities, the economic impact, if we don't take action now, will be much, much more significant. And so even though there's a very, very strong justification from a health perspective for what we're doing, this is also a strong economic reason for experiencing some pain now so that we don't have incredible amounts of pain in the future economically.
Thank you.
Yeah. Michael, did you figure things out? You can email me a question if you want at jelicker@newhavenct.gov. Any other questions from folks? Going once. Someone had a question about, okay, so.
I have a question.
Okay, go ahead, Mary. Sounds like Michael's gonna follow up with a question offline.
Okay. Just, I guess, one more question on quarantines. If anybody else, any other orders have been issued for people to be quarantined?
Director Bond?
No, not at this time.
Okay, and again, just to clarify, all the protocols for notifying people and telling them their rights, was taken care of by the hospital. That's the method.
I don't, that's the process.
Right.
I normally issue a public health order, and then they follow through their system protocols. I do not want to answer for the hospital, but that is a normal process, as it is with other public health orders of quarantine, as we do for TB.
Okay, so that's their responsibility. So if I ask them, that's the right people to ask.
That's the standard protocol.
Thank you. And again, you don't have the staff up yet for the career high school shelter if necessary. Not yet.
No, we're working very hard on it. One of the challenges is that many people that generally staff homeless shelters are not working. There's a lot of volunteers that help support homeless shelters, and because many volunteers are oftentimes retired, and that's an at-risk population, across the state, providers of services to the homeless community are struggling to have staffing, and we're struggling to identify people to help support this as well. This is the time when we actually need staffing the most, and so we're working very hard to make that happen.
Right, but it won't be volunteer staff at career.
Correct.
It's just all medical personnel.
Well, it may be a combination, but we will absolutely have qualified people that know what they're doing there. You're muted.
We have medical reserve corps individuals that are vetted and screened, and so through our medical reserve corps, we will be seeking assistance. Has actually been already assessed to see who's available, and so we're just trying to finalize those details.
All right. If everybody else is in mind, could you just, I think it was clarified in the end, but the people that were actually, the additional people that were found to have the virus, or the people that they suspected of it at the shelter, and what kind of shelter was it? Was it just an outpatient program, or people actually staying there? I'm sorry, I didn't get those details.
Director Bond, do you want to answer that?
It's a facility that that people do live and are seeking treatment.
Okay, and I'm sorry to make you go through the numbers again, but could you do that, please? The additional people. And they were different sites.
We had one additional person since we last reported. So we have 3 total that are linked within the system. 1 employee and 2 shelter clients.
Thank you.
Thanks, everyone. Take care.